Hello, my name is Rozan Javadi and I am a mental health practitioner. Today I want to talk about autism. Autism, in fact, is a complex, lifelong developmental disability that typically appears during early childhood and it can impact the person's social skills, communications, relationships, and self-regulation. Autism spectrum in some individuals can occur via a dual diagnosis, which means that they have two or more conditions, for example, autism and Down syndrome. Autism spectrum conditions sometimes can occur in the individual with medical conditions such as early epilepsy and learning, and psychiatric problems can also coexist. There are different levels of autism spectrum, and normally it has been classified in three levels, which can help the professional prescribe appropriate therapies for unique needs of different individuals with different type of autism. These therapies can help the person with autism spectrum make the most of their strengths and improve their social, language, and behavior skills. Level 1 autism spectrum is the mildest or the most high functioning form of autism. Children with level A autism spectrum have a hard time communicating appropriately with others. For example, they may not say the right thing at the right time or be able to read social cues and body language. Autism spectrum level 1 usually is able to speak in full sentences and communicate, but has a trouble with engaging in back and forth conversation with others. They may try to make friends but not be very successful. Also, those individuals may also have a trouble moving from one activity to another or trying new things. Additionally, they may have a problem with organizations and planning, which may prevent them from being independent and other people like underage. Level 2 autism. This type of autism requires substantial support, and people with autism spectrum level 2, they have more obvious problem with verbal social communication than those diagnosed with level 1. Also, in this type of autism, you can find those individuals harder can change or focus or move from one activity to the next. Normally, children with level 2 tend to have a very narrow interest and engage in repetitive behavior that can make it difficult for them to function in certain situations. For example, they may pace back and forth and say the same things over and over again. Autism spectrum level 2, they tend to speak in simple sentences and also struggle with nonverbal forms of communication. Level 3 of autism spectrum require very substantial support. Level 3 is the most severe form of autism. Children in this category will have many of the same behavior as those I explained with level 1 and 2, but to a more extreme degree. Autism spectrum level 3. Normally they have problems with experiencing different difficulties such as expressing themselves both verbally and non-verbally. This can make them very hard to deal with their daily life, and they have a difficulty with interacting socially with others and deal with change which is occurring in their daily life. Their level of focusing is very in low level, and also when they want to engage with other people socially or making communication, normally you can see just they're representing very repetitive behaviors. And the symptoms of level 3, I can say, just children or people with this type of autism, they can experience in highest level of difficulty in social interaction and communication and behavioral problem, even physical and psychological issues. Autism spectrum level 3 will have a very limited ability to speak clearly and will rarely start interaction with other people. When they will do so awkwardly. Someone with level 3 will also respond only to very direct social approaches from other people. What is signs and symptoms associated with autism spectrum condition? Uh, I can say there are different signs and symptoms, such as in a spoken language, a delay in speech development, and it can be also monotonous or flat sounding speech, which I can explain as a robotic talking, communicating in single words and rather than sentences, frequently repeating set of words. Example, young children and older teenagers, as the disease or brain disorder is developing, it can cause different difficulties, such as avoiding the use of spoken language, using pre-learned phrases rather than making new sentences, talking at people rather than having two-way conversation, and also taking things literally and being unable to understand sarcasm, jokes, and metaphorical speech of or a different figure of speech. Also, the symptoms in a different age can be manifested as a failure to understand or implement social rules. The autism condition can cause an inability to adapt tone and content of speech for different situations. Having few friends and finding difficulty to form friendship is other sign and symptoms of behavioral issue in autism spectrum disorder. Developing a very specific interest in a particular topic or subject is other issue in autism disorder condition. Autism spectrum condition severely can affect in communication, social skills, empathy, and flexible behaviors. What is Asperger syndrome? Asperger syndrome, a form of autism spectrum disorder, is a developmental disorder. Young people with Asperger syndrome have a difficult time relating to others socially, and their behavior and thinking pattern can be rigid and repetitive. This type of autism spectrum condition is characterized by difficult in social interactions, restricted range of interests, and a repetitive behavior, delayed motor development. This may result in clumsiness or uncoordinated movements. With Asperger syndrome do not have significant delays or difficulties in either language or cognitive development. Behavior normally with Asperger's syndrome include limited social interaction in appropriate social interaction, repetitive speech focusing on or discussing themselves rather than showing an interest in others, difficulties with facial expression, difficulties with non-verbal communication, avoidance of eye contact, one-side conversation, also awkward movements, additionally unusual mannerisms, inability to understand social and emotional issues, inability to understand non-literal phrases, additionally, an obsession with very specific, unusual topics, inability to see things from someone else's viewpoint. High functioning autism. High functioning autism or high level autism is at one end of the autism spectrum. This means that the signs and symptoms are less severe than other individuals with the autism. Individuals with autism, the type of high functioning one, usually have a average or above average intelligence. Usually those people with high functioning autism, they will have early language delays, unlike children with Asperger's syndrome. One major differences from other individual with autism is that those with high functioning autism and Asperger's syndromes usually want to be involved with other people. They just don't know how to go about it. They may have the problems with understanding the emotions of others and struggle to understand facial expressions or non-verbal communication. This can lead to them being teased, and they can often feel like social outcasts, which in turn can lead to depression and anxiety. High functioning autism symptoms include a delay in early language development, a delay in motor skills, inability to react with others, a strong reaction to texture, odors, sounds, and sights, difficulties with sarcasm or non-literal use of language. Thank you for watching my video, the sign and symptoms of autism spectrum in this stage is over. Hopefully you enjoyed the video. If you like it, you can subscribe the video, share it, and send it for others. Thank you. Bye.